specialist practicing at Bandra, Mumbai. Firstly, I would really like to thank Baby Chakra to give me this opportunity to talk to you all about this very important and a very not discussed topic, which is pregnancy myths. And I'm really happy to be live with all you people. So let's start with the topic today. I'm sure all of you have heard about something or the other that your elderly ladies have spoken to you about during your pregnancy. कि अरे अब तो तुम प्रेग्नेंट हो, अब तो तुम्हें 2 लोगों का खाना खाना है, और मे बी समथिंग लाइक ओ तुम्हें मीठे की क्रेविंग हो रही है तो पक्का लड़का होगा. I'm really sorry to say that all these are just myths, and today I'm here to bust all these myths for you girls. I'm going to discuss a few topics which are the most commonly Googled questions during pregnancy and the misconceptions that people have during pregnancy. And I'm going to just help and make this journey very smooth for you girls. So let's start. Firstly, the most common thing that we hear during pregnancy is 2 लोगों का खाना खाना चाहिए, which is absolutely wrong. Pregnancy should be healthy and it should not give rise to obesity. You have to eat healthy. Of course, the total requirement of calories during pregnancy is around 300 to 400 calories extra than your normal routine calories. But that does not mean that you eat so much कि बाद में जाके आपको pregnancy का weight कम करने में मुश्किल हो जाए. आपकी pregnancy पूरी तरह healthy होनी चाहिए. You should be active during your pregnancy. And that's how your post-pregnancy journey is going to be easy. What are the common things that you guys have heard during pregnancy? Something like you should not fly during your pregnancy. See, I would say that, of course, if you have a high-risk pregnancy, or if there are certain conditions that because of which your doctor has suggested you to not take a flight or go, travel somewhere, then of course you should not travel. But otherwise, there are no restrictions as such on traveling or flying during pregnancy. This is another thing that is very commonly heard, and I get a lot of questions regarding this, that doctor, can I fly, or can I go to my mom's house, or can I travel just like that because I'm really depressed or I feel like traveling. So of course you can travel. You can travel to up to 36 weeks of your pregnancy, after which we do tell all our girls to avoid traveling, because you might go into labor when you are in the flight, which is not really safe for you and the baby. So today, one more thing that I need to talk to you about is, you have a lot of cravings during your pregnancy. So girls come and ask me, कि doctor, क्या मैं junk food खा सकती हूँ? I would say I don't completely stop my girls from eating junk food, but there has to be a limit to everything. Pregnancy is a period where you have to eat consciously, because you are not just eating for yourself. Whatever you eat, it is going to have a direct effect on the development of your baby. So you have to be mindful. I'm not saying कि junk food बिल्कुल मत खाओ. Once in a while, it's fine, but it should not replace your healthy meal. It should just be once in a while, like I said. A nutritious meal is very important. If you are going to fill up your tummy with junk, how are you going to end up eating the nutritious food? And how is your baby going to get the nutrition? You have to keep all these things in mind before doing anything during your pregnancy. Junk food, make it at home and have it, no problem. You never know what the hygienic conditions are in which those junk foods are made. Maybe they are made for since a long time and they have been preserved, or maybe they have a lot of preservatives in them, or they are frozen, so it is not good for your baby. So if you can, you should avoid, but don't completely give up on your cravings during your pregnancy, because I totally understand the hormonal imbalance or the hormonal changes that you go through. You get a lot of cravings. Another one that I usually get is, doctor, morning sickness तो मुझे पूरे दिन हो रहा है, which is a very common thing, because उसका नाम morning sickness है, so people think that morning sickness happens only in the morning. But no, the name of course says morning sickness, but it is actually the nausea and the acidity or the acid reflux that happens because of your elevated hormones during pregnancy. So when you keep yourself empty stomach for a long time, there is acidity and of course there is nausea, which is why it usually happens when you're empty stomach during the entire night and then early morning you start feeling nauseous. And that is why the name morning sickness. But that doesn't really mean that it will happen only in the morning. Morning sickness usually happens in the first 3 months of pregnancy, but there are many girls who get it during the entire pregnancy, during the entire 9 months. So we cannot just say that morning sickness will happen only in the morning or morning sickness will happen only in the first 3 months of your pregnancy. Of course, we are there to help you out, and there are medicines that would help and reduce the morning sickness. But it would happen, or it can happen during any time of the day and during any period or during any month of the pregnancy. What else can I talk about? Some girls come and ask me whether they should stop exercising, or they should just take bed rest during their pregnancy because the elderly ladies in the house have told them that you should not do this, you should not do that. I would not say that you should completely be bedridden or just be on the bed the entire day, because a healthy pregnancy uh, is not the one that you're keeping on sleeping the entire day. Be active during your pregnancy and be healthy. Have a healthy diet, have a healthy lifestyle, and be active. Exercise is not a complete no no. In fact, it is a part of your healthy pregnancy routine. Of course, there might be some medical conditions in which your doctor would tell you to stop exercising, like if the placenta is low lying, or if you have certain conditions in which there are chances that the exercise would lead to early delivery or something like that. Then of course I would say that you should not exercise. But otherwise, 20 to 30 minutes of walk or any prenatal yoga, prenatal exercises done under supervision is absolutely fine. um, I think that's it from my side, but if there are any questions I can just start taking questions, because I'm sure that you girls might have a lot of these myths that you have heard. So let's see if I have any questions from you girls. Okay, so I can see somebody's asking me that certain food products, if I consume those, my baby will be fair, and if I consume certain products like tea, coffee, my baby will be dark. I get this very very often. Baby color, the color of your baby, the complexion of your baby is not it does not depend on what you eat. It is the genes, that the baby gets from the husband and the wife. You cannot decide your baby's color, you cannot decide your baby's eye color, you cannot decide your baby's you there is nothing that you can do about it, because the baby is already formed with the genes that he or she is getting from the mother and the father. So please don't think that मैं दूध पीऊंगी तो बच्चा गोरा हो जाएगा, और मैं कॉफी पीऊंगी तो बच्चा काला हो जाएगा, या चाय पीऊंगी तो बच्चा काला हो जाएगा. There's nothing like that. Next is, eating peanuts and dairy can make your baby allergic to them. So allergy is something that is acquired. I might be allergic to something, but my baby might not be allergic to the same thing. Whatever I eat is going to directly or indirectly have an effect on the baby's development, but that does not mean that if I eat something, my baby is going to be allergic to it. Once the baby is born, we have to try and give them allergens, something like peanuts or dairy or even seafood or shellfish, and only see if the baby is allergic to it once the baby starts eating it. You cannot decide the allergens by taking something yourself. You will have to decide, and you will have to see for yourself once the baby is born and once you start giving the baby those foods. So there is nothing like, if you consume certain things, the baby is going to be allergic to it when the baby is not even born yet. So don't worry about that. If you are not allergic to something, you can absolutely consume those things and not worry about causing any allergy in the baby. So let's see what I have next. Okay, this is very common. Do I have to prepare my nipples for breastfeeding? So I'll honestly tell you one thing. Our body is very capable of preparing itself for all the pregnancy related things. Like if a girl is getting pregnant, the body will have a preparing mechanism and it will prepare itself over a period of time. You cannot do anything about it. The same goes for breastfeeding. Once you are pregnant, the body is already preparing itself for your post pregnancy period, for breastfeeding, for your recovery, for everything. All you can do is have a nutritional diet, be active and just take care of yourself from within and also mentally. Only that is going to help you with your postpartum period and be happy with your child. There is nothing much that you can do about preparing yourself for breastfeeding. So I don't think that there is anything, called as preparing for breastfeeding. Um, so can I drink coffee during pregnancy? See, coffee contains caffeine, okay? And anything in excess is not good during pregnancy or even otherwise. I would say 1 cup of coffee in a day. If you're having it with your breakfast, maybe 1 cup or just 2 cups in a day is absolutely fine. But if you are addicted to coffee, like some people need 3 to 4 cups of coffee in a day, then I think you should really definitely cut down. That is because caffeine is not really good for your health any which ways, and it would have it does not really help your baby in any kind. So if you can avoid coffee, then it is absolutely required. Otherwise, just 1 or 2 cups of coffee would not harm your baby in any way. What else do we have? Okay, so the next question I think is very important. I think it's just marketing gimmicks that these creams and oils do for all these girls, all the young pregnant girls. They say that use this cream and use that oil and you will not have any stretch marks. um, but I'm really sorry to say that stretch marks are just because your body is growing. Okay, your abdominal skin, your abdominal muscles, they are growing, they're getting stretched, and that is the only reason for the stretch marks. Of course, genetics are also involved in this. That there have been studies which show that if your mother doesn't have stretch marks, you might not get stretch marks, but it is not 100% proven. All you can do is, yes, of course, hydrate yourself, keep your abdominal area really hydrated, really moisturized, which will help in reducing the itching which happens because of the stretch marks. But I really don't think that any cream or oil would avoid stretch marks. Of course, the stretch marks would fade off once you start taking care of your body after you deliver the baby, because your body is again going to go back to the normal state. And once in a certain period of time, the stretch marks start to fade off. But I don't think that any creams would really help you avoid those stretch marks. So please don't waste your money on buying these high-end creams that claim that they would just not let any stretch marks come there. So I think that's it. And let me see if we have anything more. That's it. So I think it was really great doing this live session. And I think if there are any more questions, you can follow me on Baby Chakra by following my referral code. And you can, whatever questions you have, you can just put them in the comment section below, and I would be happy to help you girls out. And I hope this session was helpful and really nice being here.